Ergonomic injuries, meeting guidelines, goals. This safety session should teach employees to understand the risks and symptoms of ergonomic injuries and know basic ways to avoid ergonomic injuries. Number one, good ergonomics adapt the job to the person instead of forcing the person to fit the job. It reduces physical strain, pain, and possibly serious injuries. Number two, poor ergonomics causes painful musculoskeletal disorders, also called cumulative trauma disorders or CTDs. These are painful, sometimes crippling injuries that generally affect upper body nerves, tendons, tendon sheaths, and muscles. They may develop from frequent, repetitive motions on a machine or keyboard, packing, cutting, etc., forceful exertion of your arm or hand, use of vibrating or impact tools, and awkward positions or movements. Carpal tunnel syndrome, a common CTD, occurs when the nerve that runs through the wrist's carpal tunnel is pinched. Initial symptoms are numbness, tingling, and weakness. It can reduce strength and mobility and may cause permanent damage. Tendinitis, which is arm or shoulder tendon inflammation, can result from overuse or strain. Number three, minimize repetitive movements to avoid ergonomic injuries. Repetitive movements are the most common cause of carpal tunnel syndrome. Avoid repetitive movements whenever possible. Switch tasks and positions to reduce time spent on repetitive motions. Number four, organize your work area to minimize CTD risk. Set up your workstation so that your work surface is at waist height. The tools and materials you need are within a 20-inch reach. Use a chair that offers back support and adjustable height. Position computer keyboards so you work with straight wrists, elbows at right angles, and arms resting at sides. Choose and use tools with ergonomics in mind. Select tools that are comfortable to use and hold. They should be lightweight, easy to grip, and not require extreme effort. Choose the right tool for the job to reduce strain and awkward positions. Grip tools so the thumb and index finger overlap slightly. Avoid bending your wrist while holding tools. Use clamps, jigs, etc. to help avoid awkward positions and bent wrists. Carry materials using a palm-down grip. Reduce vibration-related injuries by operating tools at the lowest efficient speed possible. Hold tools as loosely as possible without losing your grip. Use mechanical aids, not your hands, to grasp and hold materials you're working on. Keep your hands warm. Cold hands make you grip tools and materials too tightly and are more likely to develop problems from vibration. Number 6, don't ignore symptoms of ergonomic injuries. Report it immediately if your arm, neck, shoulder, hand, wrist, or fingers feel pain or aching, numbness or tingling or stiffness, burning, swelling, or weakness. Discussion points. Ask participants for examples of poor ergonomics on their jobs. Then ask for suggestions about how to improve the ergonomics of those tasks or tools. Conclusion. Good ergonomics means listening to your body. Numbness, pain, and other symptoms means you're forcing your body to do something it wasn't meant to do. Look for ways to reorganize your work to avoid ergonomic injuries. Ergonomics. Build your workspace around you. Use good ergonomics to avoid injury. Poor ergonomics equals a task or tool that exposes you to frequent, repetitive motions on a machine or keyboard, packing, cutting, etc., forceful exertion of your arm or hand, vibration, awkward positions or movements. Good ergonomics equals a task or tool that minimizes repetitive motions, alternates repetitive motions with other tasks, positions the work surface high, waist high, places tools and materials within 20 inches, uses a chair with adjustable height and back support, positions a computer keyboard for work with wrists straight, elbows at right angles, and arms resting at sides, has light, easy grip tools that don't require extreme effort, grips tools so the thumb and index finger overlap slightly, avoids bending wrists, holds materials with clamps or jigs, and allows you to carry materials with a palm down grip. Payroll stuffers. Avoid ergonomic injuries. Good ergonomics adapts the job to the person. Musculoskeletal disorders may result from repetitive motions, forceful exertion, and awkward positions or movements. Carpal tunnel syndrome occurs when the nerve in the wrist carpal tunnel is pinched. An ergonomic work surface is positioned at waist height. The tools and materials you use should be within a 20-inch reach. An ergonomic tool is lightweight, doesn't require extreme effort, and is easy to grip. The ergonomic way to carry objects is with a palm down grip. Good ergonomics with vibrating tools includes operating them at the lowest efficient speed. To prevent long-term ergonomic injuries, you should immediately report when your arm, hand, or other upper body part experiences pain, numbness, or tingling. To prevent ergonomic injuries, it's best to keep your hands warm.